very aware of the OCT conferences in general, having kept aware of them and abreast of them over the last few years. So it's always interesting, there's always good speakers, there's always interesting ideas and the sharing of ideas and the ability to network. I was talking about how we need to build relationships with our service providers, our vendors, how to manage them, oversee them, and actually the models and how we incorporate risk and risk assessments in that, and how we can then improve that to meet the new regulations that are coming out with ICH E6R3 later in the year or early next year. Well, I think obviously the use of technology is immense. The use of AI, DCTs, what were considered pre-COVID as disruptor technologies now are part of the normal clinical trial process, and people need to use them and incorporate them into clinical trials and also the development of new molecules. AI, for instance, using that as a searchable function to identify potential drugs of the future is going to be a very hot topic in the next 5 to 10 years. Oh, well, I mean, there's lots of ways, from reading about the various online tools that are available, the number of online publications, meeting agendas, meeting things. LinkedIn is always a great tool for getting information and assessing and amassing information from a variety of sources. But the things like clinical leader and other sources of information that are published on a very regular basis are a very useful place for information.